Texas Children's Hospital serves the greater Houston community at this point, and we are one of the largest pediatric hospital in terms of numbers. We serve a huge population when we run almost a little shy of about 3 million tests just in the medical center. So one of the most beautiful things about Texas Children's Hospital and its staff is that we have a passionate bunch of people who love to serve the population of children and women. There are some very specific tests that we have for our patient population, and one of the classic ones that I like to begin talking about is the BUBC slides, which are really not there in any of the other systems. Only VITROS has it. It's important to pick up these kids that have disorders of conjugated hyperbilirubinemia, like for example biliary atresia, where if you actually identify these babies in the first few weeks of life, which can avert them having to have a liver transplant and going through all of that. So this is one aspect which I really love about the VITROS and why I can't think about going to another different system. We want the best system because we don't think of this as just a test tube, right? At the end of the tube, at the end of the vacutainer is a little baby. What it is slides that have pairs. So you have 2 parameters instead of 1. So we have a cholesterol triglyceride. So things that would normally be ordered together. So one, you're getting 2 tests instead of 1. And secondly, you have the turnaround time that's required when you're measuring 12 different analytes at one time. The other thing is with little kids, they're not little adults, but what's important is blood volumes. And QuidelOrtho systems, they boast for the lowest volumes of sample that's required for the testing. We've done a comparison between the 5600s that we had and the XT 7600 and the newer technology, and we've shown in a beautiful comparison that while maintaining that kind of accuracy that VITROS has with precisions of less than 3% CVs, we've also shown that the volumes in the 5600s were low. The 7600s, using the XT double slides, you use even half the volume. And what more can you ask for when you're trying to bleed a child that is sick? And the second thing is turnaround time. You have a sick baby in the emergency room or in the NICU, you want results as quick as possible. Both us as well as QuidelOrtho is engaging in more sustainability metrics when it comes to the 7600 XTs, and it has certain features that aid in this sustainability. One is less wastage, so instead of wasting 2 slides, you're only 1, right? Less storage space in the lab, which is huge, so you have half the storage space but double the capacity. And you have LEDs now installed within the VITROS, which obviously are energy efficient. I would recommend any pediatric clinical lab to only choose QuidelOrtho, and especially the 7600 XT systems. From the time I have been at Texas Children's, we've had these many systems across the years, and with every system, things have only gotten better. We have this constant communication between the groups at QuidelOrtho and us, including the R&D divisions, because without this kind of partnership, we can't do it alone. So for us, it's really a slam dunk when it comes to choosing QuidelOrtho for our clinical chemistry labs.